Health officials are warning travellers to watch for symptoms of a mystery pneumonia hitting Asia. 9 people have died of the highly contagious disease and many more have been infected.
It began in a wet market in China. A virus thought to have originated in bats spreads through the local population. There is no vaccine and nobody is immune. This isn't today. This is 2003. The illness? Severe acute respiratory syndrome, SARS.
The symptoms of SARS were very similar to those of COVID-19, dry cough, fever and muscle ache. And that's because SARS was caused by a coronavirus. It was the first example we had of just how lethal a coronavirus could be.
SARS spread to 26 countries, infecting a little over 8,000 people before it was brought under control. But those numbers are dwarfed by today's coronavirus. In just 5 months, it spread to almost every country in the world, infecting more than 4.5 million people. The two viruses look almost identical, but only the virus on the right brought life as we know it to a grinding halt.
So why did this coronavirus go global when SARS was stopped in its tracks?
Munich, Germany. It's late January and the pandemic has not yet taken hold in Europe. But at the offices of the Webasto Group car parts company outside the city, an outbreak is starting. In the canteen, an employee passes the salt to a colleague and infects them with the coronavirus. 2 days later, 2 workers share a computer workstation, and the virus jumps again. The next day, one of those workers sits beside another in a 90-minute meeting. Over 12 days, 16 people are infected. It is the first documented case of multiple human-to-human transmissions outside Asia. A group that's become known as the Munich cluster. Colonel Roman Wolfel is a virologist in the German military.
Good morning, can you see me all right?
Perfect.
Roman wanted to find out how the virus had spread so easily amongst this cluster of patients. So the Webasto workers were tested, not only to confirm who carried the virus, but also to find out where in their bodies that virus was reproducing. Many samples came back negative for infectious viral particles. But the throat swabs astonished the team.
Those samples were highly positive for the new virus. We are talking about 1 billion viruses per milliliter. The virus is obviously able to replicate in the upper respiratory system.
The SARS virus replicated deep in the windpipe and lungs. But today's virus seems to reproduce in the upper respiratory system, helping the virus spread.
With the virus replicating in your throat, the distance for the virus is not too far. You don't have to cough necessarily to basically to spit out little droplets, and those droplets might cause the infection in others. So this is one of the most important new features of this virus.
We've seen coronaviruses that replicate in the nose and throat before, but they usually just cause the common cold. What's different about this virus is it travels down the body to become deadly.
Some people, it migrates further down the throat. It becomes more like SARS. It can even go down into the lungs, where you develop pneumonia and you become seriously ill. So it's the fact that it can do this and then that which makes it so scary.
But the reason this virus is more transmissible than SARS isn't simply because it starts out in the nose and throat. It's also because of the point when infected people can start passing the virus on, a process known as shedding. Something scientists discovered when they identified the source of the Munich cluster's infections. On the same day the salt shaker is being passed around in the Webasto Group canteen, a businesswoman arrives at Munich airport, returning to Shanghai after 4 days of meetings at the car parts company. although she doesn't know it, she has COVID-19 and will be hospitalized soon after she lands in China. It's believed she is responsible for starting the first documented chain of infections in Europe. But throughout her stay in Germany, her symptoms have been so mild, no one realized anything was wrong. Could there be a lot of people out there carrying the virus without knowing it? A chance for scientists to investigate came in early February, when the Diamond Princess cruise ship docked in the port of Yokohama, Japan, with the novel coronavirus running rampant on board.
All the passengers have been confined to their cabins for the next fortnight.
This outbreak offered a unique opportunity to follow up the passengers and the crew over a substantial period of time.
Health workers tested more than 3,000 people on board. 634 were found to be carriers. But to the shock of the team, an enormous proportion of these carriers displayed no symptoms at all.
About 46% didn't have any symptoms at the time of testing. That was alarming. It opened our eyes to this peculiar property of the virus.
Scientists still don't know how many asymptomatic people there are. But even in those who do develop symptoms, the virus incubates for 5 days on average, and sometimes up to 2 weeks, without causing obvious signs of illness. Couple this with evidence Roman was gathering from patients in the Munich cluster, and it becomes clear how significant silent spreaders could be in transmission of this virus. So when were they producing the most virus?
They have a high viral load of virus in the respiratory system in the throat during the first 5 days of disease. So during the first 5 days, it's most likely that they transmit the disease to others.
Back in the 2003 SARS outbreak, people didn't reach peak infectiousness until day 10, and their illness was obvious. That meant the outbreak could be brought under control, identifying and isolating patients. But people carrying today's coronavirus can shed viral particles from the throat into saliva even before symptoms start. And these can then easily pass from person to person.
You might imagine the best strategy from the point of view of a lethal virus is to get into somebody and then kill them very rapidly. But this coronavirus has a different strategy. It gets into you, become infected, but you don't feel bad. You have no symptoms. That means you're going to go out there into the community and spread the virus everywhere.
But there was one final factor as to why today's virus went global when SARS didn't. Timing. When SARS emerged 18 years ago, China's transport infrastructure was less developed. Now there are nearly 9 times the number of people flying internationally from China. And to compound this, the virus struck just before Chinese New Year, the largest seasonal movement of humans on the planet. It's estimated almost half of Wuhan's 11 million residents had left the city to visit family before the lockdown, many taking the virus with them.
Now the virus is amongst us, changing the way we live at an astonishing pace. What we're starting to see is how it is affecting different people in Britain in very different ways.